Good afternoon, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stein. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. Joining me today, Dr. Kristen Mahan, one of my colleagues in family medicine. Adam Thacker is out on a special assignment in Decker today, so he'll be joining us hopefully in another couple of weeks. But we're going to be giving you the usual COVID update. Lots has been happening since we spoke last, and the majority of those things are good things, thankfully.
Yes.
So we always start out with numbers, around 10,000 or so cases since we started. And the interesting thing, of course, is the numbers we talk about positivity rate. So positivity rate has dramatically changed. If we look over the course of the past 4 to 6 weeks, we are now down to a positivity rate of about 7%, which we haven't seen a single-digit positivity rate in months. The other thing that has changed dramatically is if we look at our state map, we have been red for as long as I can remember this year, and we have now moved down to orange, and we are probably more dramatically moving back down from there over the course of the next week or so. And I think what we're seeing in the clinical setting reflects that as well.
Oh, I think that's true. And so one of my roles is medical director at Convenient Care Clinic, and obviously our 2 convenient care locations were extremely busy over the last many months, and volumes there have decreased significantly. And the number of tests for COVID being done has decreased significantly because we just don't have as many symptomatic or sick people. And so that's something we're all really grateful for.
And numbers-wise, just to kind of put that into perspective, kind of at the peak when we were seeing huge volumes, 200 or plus visits at convenient care when things were peaking.
Yeah, so some of our worst days were around 200 total visits a day, tests and people being seen, and that's exceptionally busy for the physical space and the staffing that we have there. And those numbers are probably some days maybe even a quarter of that, or 25-30% of what we were seeing on those busiest days. So that's been a nice bit of relief for the people working there, and also a nice relief for our community to have much less COVID going around. So it's not zero. We still have some COVID cases, but they're fewer and farther between.
So kind of post-game analysis as to what all has happened here. What has happened in the last few months or so, presumably, is we saw a tremendous rise in cases. Things were dormant for a little while. Omicron came along, highly infectious. Thankfully, not as much morbidity and mortality, not as many hospitalizations, but nearly everybody got it. Basically, when we look at the population, and even when people had it, they weren't as terribly sick, thankfully. But this spread throughout the nation, communities, and the world rather quickly. And so that spike has come up, that spike has come back down. And so now we are seeing very few patients that are sick with it, period, and even less that are severely ill. But we're still talking that the importance is to make sure that we stratify our populations into those high-risk populations and lower risk. And I think sometimes people are sort of confused about that.
Yeah, absolutely. And so I think there are multiple reasons to think about that. As an individual, where you fall in that risk spectrum. First of all, I think we would still encourage anyone who, has not been vaccinated. If you're thinking about that at all, I would still recommend you do that because, again, COVID cases are not zero. And also, we don't exactly know what comes next from the standpoint of potentially another wave of COVID. That remains to be seen. But from a risk standpoint, if someone is higher risk, and some of those conditions that would put you in that category would be, age over 60, chronic conditions like diabetes, lung diseases like emphysema or asthma, diabetes, chronic kidney disease, even high blood pressure increases risk of serious illness from COVID. So, if you fall into that category of higher risk, or if you have any trouble with your immune system, either because of an underlying condition or medications you take, your risk of becoming seriously ill from COVID is much greater. So, 2 impacts there. Number 1, get vaccinated if you haven't been. And number 2, if you think you might have COVID, so you get symptoms that maybe seem like a cold, stuffy nose, cough, with or without fever, feeling a bit under the weather, you should be tested for COVID. And if you're positive and have any risk factors, you should be seen by your physician or at our convenient care clinic, because we do have treatments to dramatically reduce risk of serious illness and hospitalization. One of the impacts of our declining numbers of COVID cases and expanding availability of treatments and medications is that we have ample availability of medication to treat people who get COVID to reduce their risk. So, we went through a period of time where we really did not have an adequate supply of appropriate monoclonal antibody or other treatments. And, that issue has resolved. We have improved supply. We have less demand because of fewer COVID cases. So, importantly, if you are high risk for serious illness from COVID and you get cold symptoms, fever, etc., get tested and be seen so that you can get appropriate treatment and reduce your risk of winding up in the hospital.
Yep. And for that lower risk population that doesn't really have illnesses and don't have other comorbid factors, we would ask those people to simply follow the guidelines that we have been discussing for 2 years now, which is, first of all, don't go to work, don't be around other people, isolate yourselves for an appropriate period of time. And that period of time has gotten shorter as we have kind of looked over the course of the past couple of years. The 10-day quarantine, the 14-day isolation, so forth, when we talk about those, that's been reeled back in because the course of the illness seems to be shorter, now down to 5 days, but we still encourage people to recognize the fact that when they are symptomatic, that time period doesn't end. If you are still sick, your 5 days are not up and you go back to work, you need to make sure that at least 48 hours to 72 hours has passed from that time period to make sure that it's safe to return and be around other individuals.
Right.
One of the things that Dr. Mahan was touching on there that I think is really important is a lot of people are sort of questioning why things have changed so dramatically from 2 years ago and 1 year ago and now. And it's about those availabilities that you described, availability of adequate testing, availability of treatment. As we heard in the President's State of the Union speech last night, a second round of available tests now can be ordered in the near future. So if individuals have not gotten those tests or they don't have their own tests available at home, that's something that you can sign back up for and get another round of tests sent to you at your household. And the whole purpose behind that is to identify patients early in that course of disease. So again, as you said, tremendous availability of testing now compared with even a few months ago. And as a result of that, people can identify when they are sick. They can either choose to stay at home and isolate on their own if they don't have a lot of those risk factors, or, as you said, get in, be evaluated by a provider, and see if you're a candidate for treatment. Because the other huge thing that has changed is now we have multiple categories of medications, not just monoclonal antibody therapy, which we used over the course of the past year and a half, but also the other alternative medications, including the direct antiviral medications that we have, the other infusions that we have used in the inpatient setting, and all of those things are now available, which we simply didn't have access to previously.
Absolutely. And I think not to get into too much detail because not everybody wants all the nitty gritty on the drugs, but in general, monoclonal antibody is still in many cases our preferred treatment for high risk individuals. And as I mentioned, we do have a good supply of that currently. But as Dr. Stein mentioned, we also have used a medicine called remdesivir, some in outpatients, primarily when we did not have adequate monoclonal antibody and our supply was out. Remdesivir is an antiviral drug used through IV treatment, and that's been used in the inpatient world through much of this pandemic. And there's actually 2 oral medications. So in those have to be prescribed carefully because of some drug interactions, potential side effects, and so forth. But treatment options are out there and in multiple forms, and again, primarily targeted at our higher risk patients to reduce their risk of hospitalization or requiring a ventilator or death. So when in doubt, I think the answer is, talk to your provider or be seen by your physician, be seen at one of our community care clinics if you're concerned about COVID.
So the other huge thing that came out just a couple of days ago was CDC masking guidance has changed. And we get lots of questions on this because it's probably even more confusing now than what it was before.
Much
when
more.
Everybody is masked, no question, and so forth. But it's not a terrible, difficult concept to put into perspective, which is we look at a couple aspects of this now, which is number one is how prevalent is the disease in your community. We are now here in Knox County in the moderate risk category, and we are rapidly going to be moving into the low risk category. But you want to look specifically to the region that you are in, and this is something that we've believed kind of from the beginning, that if there's not a lot of disease in your community and the risk is low, then less precautions need to be taken. And if there's a lot of disease in your community and the risk is high, then more precautions need to be taken. And we've sort of ramped things up and ramped things down over the course of the past couple of years within our county and also within the nation, depending upon what's going on in your specific region. So the first thing is to look to see how prevalent the disease is. And if you go to cdc.gov, you can actually put in your state, put in your county, and it will tell you what your risk category is. And then the second thing is what Dr. Mahan was alluding to, which is how high a risk individual are you? If you have a lot of risk factors, even if the circumstances in your county are low or moderate, you should be masking. But if you are an individual that has very few risk factors and are otherwise healthy, there's probably not much value in masking at all. And so that's really been the big guidance change over the course of the past couple days with the CDC, is to basically make that recommendation tailor-made to your region and also specifically to those individuals. So when we kind of roll things back to the beginning, almost 2 years ago, when we didn't really know as much about what circumstances put people at risk, we've learned a lot in the past couple of years as to what individuals are high risk. We have a lot more tools in our treatment armamentarium, and now testing is much more available. So all of those things have made things considerably better. Now, one of the things that you and I were speaking about just before we came on camera was that all of the usual things are still going on, including influenza and mononucleosis and strep. And so it's important to realize that that stuff is still out there.
Absolutely. And so one of the things I've observed in my practice this year is that for whatever reason, we seem to have a downturn in how many people got influenza vaccines. And I suspect that's just because people have been very focused on COVID. And so some of our higher risk people that usually come get flu shots didn't do that this year. I saw a case of influenza A yesterday in my office. Those cases have been fairly few and far between through the winter, but not absent. And so, over the last several years, we've still seen quite a bit of influenza during the spring months. And, through March, April, we are going to probably see several cases of flu. So if you've not yet been vaccinated, there's still a lot of value in doing that at this point in time. And again, flu vaccines are available essentially to everybody 6 months old and older. But particularly, you need to think hard about that if you have risk conditions to wind up hospitalized from influenza. And those are many of the same things you would see with COVID. So these primarily respiratory illnesses, obviously people with chronic conditions, heart disease, lung disease, diabetes, you're at higher risk of hospitalization or serious consequences if you get influenza or COVID. So don't forget about those flu vaccines. And we also have medications, antiviral medications to treat flu. So if you're sick, if you've got fever, if you're high risk, get checked out so we can take care of those things.
So that, of course, begs the question is, what do we see and what do we predict the future of vaccination for flu, for COVID is going to be as we roll into the fall?
Oh, do you have the answer to that, Dr. Stein?
I got a best guess. So we've talked a little bit about this in previous episodes, that presumably this is going to become a seasonal illness, much like influenza is, and that's what we presume is probably going to happen as we roll into the fall. Now, that is barring any new Greek alphabeted variant that rolls through during the summer or fall season. But the thought process is that now as we are further out with more people vaccinated and we have more experience with different variants and how the vaccines work, they've actually determined that the vaccine status when people have had one shot and then their typical booster, that their immune status probably is holding up and lasting better than what was initially predicted. Those vaccines, once somebody is fully vaccinated, that they are doing well against other variants. And as we are kind of watching that march forward, what we hope is that continues to be the case. So for a while, 3 or 4 months ago, we were hearing on the news that there would be a booster every 3 months for all of us, for all of eternity, and that sounded horrible. But the more recent research looks like that having your initial vaccine and then being fully vaccinated and boosted basically conveys tremendous immunity, and it probably lasts longer than what we thought.
Sure, and I think there's still a fairly big question mark out there as to where we go next. And so the answer is stay tuned. Right now, it is get your primary series, which is typically 2 shots, and then a booster 6 months after that second dose of your Moderna or your Pfizer vaccine. So, and there's been a lot of discussion about Johnson & Johnson, and if you had that, what do we do with that? And in general, there is a pretty substantial school of thought in the medical world that really the J&J vaccine probably should have been a 2-shot series to start with. So the bottom line is see your provider, go to our county health department, talk to them. But if you have had your primary vaccine series, get your booster 6 months later, and protection is holding up pretty well at this time. And, we'll see what the future holds as far as seasonality and future variants. And so there's still some question mark there. But right now I've had, some patients asking me, so it's been 6 months since my booster shot. Am I supposed to go get another one because it's 6 more months? And the answer is no, not right now. There may be rare exceptions to that in people who are immunocompromised or who were immunocompromised when they got their original vaccines because of medications or chemotherapy or things of that nature. So that may be an exception. But at this point in time, if you've had your first 2 in your booster, that's it.
So in general, around the nation and around locally, masks are coming off. We will continue to do our standard masking protocols here within the hospital, and I would predict most hospital facilities are going to be doing the same. As the months roll by and we see the county go from red to orange and orange to green, and if there's anything better than that, don't know, but as we see that happen, we will reevaluate those as we go by too. Sure. People are also going to be happy to know that our visitation policy is going to be changing too. Instead of just the single one visitor that we have right now as our policy, by next week we will be allowing 2 visitors in the hospital, and same rationale that the disease burden in the community is lower, therefore risk is lower. Right. So having more supportive family members in the hospital, as soon as we've seen that improvement, that's going to be pulled back, and that should be within the next week or so.
Sure, and just like we do now, and really in general always, people who plan to visit family members should be certain that they aren't feeling ill, they don't have fevers, that they're not sick in some way, whether that could be COVID or flu or some other illness, because you're coming into a situation where you are visiting someone who's probably already compromised from a health standpoint, and you don't want to get them or a neighbor sick in the hospital. And also, as Dr. Stein mentioned, masking will still be in place as we expand to those 2 visitors. Again, trying to protect our more sick, our high-risk patients who are already hospitalized.
Yeah. So as we kind of roll through the course of the next few months or so, we'll continue to do updates periodically. We won't go back to every week like we did over the course of the last year, but we'll be getting back with you on a routine basis and touching base on things. Again, cdc.gov is an excellent resource to get those numbers as far as what your local and regional status is. Again, we're in moderate risk now, but we fully anticipate that's going to drop into the lower risk category, just because it takes a little bit of time for that data processing, and as those numbers have come down from red until orange, we're going to see that drop again within the next week or so. So that's an excellent resource. Also helps a little bit to understand the masking guidance that has changed from the CDC as well. Our schools have pulled back on all their masking requirements as well, and so stay tuned to see kind of if there are any changes to that, but we fully anticipate that as long as numbers continue to look good, that will be the way things are played. Tiffany, you have any questions for us for today?
There was only one question regarding the visitation policy, so you covered that a little bit. I also said that they're currently looking at the policy, and we should be getting information and updates out on that soon.
Excellent. Any other things from your standpoint, Dr. Mahan?
I don't think so.
All right, very good. Well, thank you all very much for joining us. We'll be back with you in a couple of weeks. And if you have any questions, please put them online.